The COVID-19 pandemic has stripped us to the bare minimum and exposed our soft underbelly. We're advocating for social distancing and hand washing, all very important measures, but measures that have exposed how the less privileged in our society live. Incidentally, it was World Water Day this past Sunday, the 22nd of March, and the figures from water.org show just how difficult the simple concept of hand washing is in Kenya. 41% of Kenyans still rely on unimproved water sources such as ponds, shallow wells and rivers, while 71% of Kenyans use unimproved sanitation solutions. These challenges are especially evident in the rural areas and the informal urban settlements. Only 9 out of 55 public water service providers in Kenya actually provide continuous water supply, leaving people to find their own ways of searching for appropriate solutions to these basic needs. Further, we are rightly asking for social distance. But have we taken the time to think about how difficult it is to be distant from your very livelihood? Before branding people ignorant for not staying at home, put yourself in their shoes for a moment. Tonight, you may be among the lucky few. You probably have some savings, even if it's a few thousands of shillings. You may have 2-year plans, 5-year plans. You have a job. You have investments that you would like to see through to the next generation. But now take a moment to think of the people who live on the fringes of existence, living day to day with uncertainty of where their next meal will come from, living below the proverbial $1 a day, which, by the way, is 100 shillings a day. They are unbanked, unseen, unheard. These people are living on the edge, courting death and disease every day. So for them, contracting the virus that causes COVID-19 is probably the least of their concerns. Folks, I'm not saying that social distance, staying at home, and hand washing are all not important. They are. That is, in fact, what will make the difference, flatten the curve. But you see, all of these terms only make sense when put in context. We need to take these terms and concepts and tailor-make them to the Kenyan setting. What does social distancing look like for the single mother who has to sell vegetables at a local market to feed her 5 children? What about the barber who is paid based on how many he shaves in a day? What about the construction worker or the so-called Mama Safi who moves from door to door looking for work? When we tell people to wash their hands, do we care to know where they will get the water? Because for many of these families, the choice may well be between buying water to wash their hands 12 to 14 times a day as advised and putting a meal on the table. Sadly, there is no guessing which one will win. This is why the COVID-19 crisis is a moment of truth for all of us. What have those in power done over the years to uplift the livelihoods of the most vulnerable in society? Providing jobs, meaningful ones, instead of just outsourcing that role to youth themselves through such fancy terms as entrepreneurship and self-employment. Oh, and while we have this opportunity, let's fix the basic building blocks of our healthcare system, making it more responsive to patients' needs. Let's give priority to the health workforce and service delivery rather than financing big, shiny hardware. Let's throw money at the solution rather than at the problem. Whilst the COVID-19 is a nightmare at the moment, it will surely pass. But it definitely won't be the last. Let us use this perfect opportunity to finally fix what is wrong with Kenya, once and for all. And that is my take tonight.